and issues shaping our community. This is Comcast Newsmakers.
Imagine having brain surgery and 2 weeks later, you're back at work. It's possible thanks to a minimally invasive surgery. Here to tell us how this surgery works and how it helped one local patient is the medical director for the Miami Neurological Institute, Dr. Santiago Figuereo. And thank you very much for joining us. This is an advancement that's taking place as far as neurological surgery, right?
That is correct. The field of neurological surgery has recently taken on the new advances in technologies that have been developed for approaching the body in other areas, like in the abdomen and in the chest, to now approach the brain and perform procedures that in the past would require big operations. Nowadays, with the advances in high-definition technology, we have very small cameras that we can introduce in parts of the body and use what is called natural orifices to access those parts of the body and do procedures that in the past would require big operations.
We have some video of a procedure that's taking place, and for people at home, this might be a little graphic, but we just want you to be aware of that. But this is an operation that takes place on the brain, right here.
That is correct. This is an operation actually in the back of the nose. In this video, we are approaching the pituitary gland, or the area where the pituitary gland is located. There's been a big tumor resected there. And this is a large tube with a camera at the end, very thin tube that is being introduced through the nose, getting in the back of the nose where the tumor has been completely removed now, and you can see the pulsations of the brain that is being relaxed after resection of the tumor.
What are the different type of maladies that this type of procedure would be applicable for?
There are a variety of lesions that could be treated with endoscopic approaches. The most common ones are tumors of the pituitary gland, which is a gland that is located in the base of the brain, right behind the nose. So going through the nose has been a traditional approach to access lesions in this location. However, in the past, or the traditional approach involved cutting through the nose and causing a lot of damage that disfigures and cause some numbness in the face and a recovery that is very lengthy also because of problems breathing. Now with the camera, we can do this type of procedures, and patients the next day feels like nothing happened.
Really?
Correct.
That's amazing. You have a situation here where you see more sophistication taking place in surgeries. Do you think this is going to translate and evolve even more?
The technology keeps evolving and it keeps advancing. Now with high definition, with smaller cameras, we're able to put a lens very close by to a lesion, and the approach and the techniques to how to remove that lesion with very small tools, it keeps changing every day. There are companies that are involved in and dedicated full-time to develop and improve on those instruments. We can do intracranial lesions like tumors, and colloid cysts, for example, that we can resect to very tiny incisions, going through very tiny holes through the brains with very tiny instruments. So at the end, you look at the images and it looks like nothing has happened.
For a physician, a surgeon, you really had to totally relearn your art, didn't you?
That is correct. I mean, we make the comparison to playing Nintendo. So the new generation who's used to play these games are more apt to actually take on these technologies and manage them, while in the past we were used to do big procedures with big tools.
And I suppose for the patient, they come in with a lot of angst and a great deal of trepidation, and you actually are able to have a positive outcome very shortly.
In most of them, it's very impressive. Actually, we like to educate and the community in the sense of for them to know that technology is out there, it's evolving, and now procedures that were very traumatic in the past don't need to be anymore.
Okay, this hour's Newsmaker showed us how minimally invasive brain surgery helps patients get back on their feet faster. I'm Spero Canton for Newsmakers. Thank you very much for watching.